where 1 in 5 American adults experiences mental illness, such as depression, anxiety, and ADHD, according to the National Alliance on Mental Illness. Throughout the COVID-19 pandemic, concern for mental health has only grown, with growth in depression and anxiety rates, according to the CDC data. While mental health concerns are common, effectively treating these conditions can be a challenge. Findings from the GeneSight Mental Health Monitor show that more than half of those diagnosed with depression have tried 4 or more depression medications in their lifetime.
I went through a very traumatic experience in my life that resulted in a very acute case of depression, and I just couldn't get out of bed, no matter how hard I tried. For the following 3 years, I went to different psychiatrists, and it was like throwing darts at a dartboard, except that I was the dartboard.
This trial and error process can be frustrating, time-consuming, and expensive. A report published in the American Journal of Psychiatry shows the percentage of patients who achieve depression remission may actually decrease with each medication change. Less than 40% of patients achieved remission with their first depression medication. Only 31% achieved it with their second, and their chances for remission continued to decrease with each additional trial. But as Dr. Tin-Lei Tang, medical director of the Nashville Brain Institute, explains, finding a medication that works for a patient can be very difficult.
We try to individualize the patient's treatment plan because each patient is different. Their genetic composition is also different.
Innovations in genetic testing may help doctors understand how a patient's unique DNA may impact how they respond to or metabolize certain psychiatric medications. All it takes is a simple cheek swab. The patient's sample is then analyzed in a secure lab, and the healthcare provider gets a report, which may provide insight for how quickly a patient's body may break down or how it responds to a medication. The GeneSight test is one of those genetic tests.
If a medication is broken down more quickly than normal, you may not have enough of it in your body, which may be ineffective for treatment. In that case, the clinician may need to consider using a higher dose of that medication. But on the other hand, if you break down a medication more slowly than normal, there may be too much of that medication in your body, and in some cases that could lead to side effects. In that case, your clinician may need to consider using a lower dose of that medication.
For patients like Ronnie, the test made all the difference.
The results came back in 3 distinct columns. So they added 1 more medication in a very low dose, and I was a completely different person. It was remarkable. I could see the possibility of a future with happiness.
The GeneSight test has been ordered by tens of thousands of healthcare providers for more than 1.5 million patients.